and today I'm going to perform open gloving return demonstration. Wearing gloves decreases the risk of healthcare workers' hands become contaminated with blood or other bodily fluids. Additionally, it lowers the chance of harmful germs and microbes being transmitted from healthcare workers to a patient as well as the environment. Before conducting this procedure, I have thoroughly washed my hands. It is important to keep in mind that using sterile gloves does not replace the need to wash our hands thoroughly before and after every procedure. I already prepared my sterile gloves, verify if the gloves are the proper size, and check if the packaging is free from stain or tears. It is important to ensure that the gloves fit properly to maintain the comfort of the user, prevent contamination. It would be more difficult to handle objects and it would be easier for germs to enter the gloves if they were too big. However, if the gloves are too small, they are more likely to tear or they will decrease the blood flow to the fingertips, which cause discomfort, numbness, and limitation in use of the fingers and hands. I will now take off the package. And identify the right and left cuff. So, grasp the inner package and set it down on the clean, dry, flat surface since moisture can contaminate the gloves. The surface should be waist level because anything below the waist is regarded as contaminated. So now, open the inner wrapper and identify the left and the right gloves. You must glove the dominant hand first to make application easier. I will start by gloving with my right hand because I'm right-handed. So I'm going to grasp the gloves cuff to do this. It is important to bear in mind that we should only touch the inner part of the gloves with our bare hands in order to keep it sterile and prevent contamination. Carefully pull the gloves over the dominant hands. And being sure that it doesn't not roll up to the wrist to ensure its sterility. Make sure the thumb and fingertips is in the proper spaces so you can now move them comfortably. So I've finished donning my glove with my dominant hand and now I'll do it to my non-dominant hand. So I'll do this by carefully slipping my fingers underneath the cuff of the second glove and slipping my non-dominant hand inside. Do not allow fingertips and knob of the glove dominant hand touch any part of the exposed non-dominant hand to keep its sterility. So now that my both hands are gloved, I'm going to adjust the gloves and make it more comfortable. I'll then interlock my hands together in front of the body. After that, holding them away from my body will prevent me from unintentionally touching non-sterile items. So, in order to remove the gloves, all we have to do this is first remove the glove on our dominant hands by pitching the palm of our dominant hand and carefully remove it. Then, we're going to slip our fingers on our dominant hand inside the cuff of the non-dominant hand and remove it. So, after that, we can discard the gloves before perform and hand hygiene after this procedure. That would be all. Thank you.